Thanks.
Good afternoon, and thank you for joining Bruce County Public Library for this presentation. My name is Nancy Cool, and I'm the program coordinator for Bruce County Public Library. January is National Alzheimer's Awareness Month, and so to, just hang on one second here. So during this month, we are invited to learn more about dementia and its impact on Canadians. Over 500,000 Canadians today are living with dementia, and 1 in 5 Canadians having experienced caring for someone living with dementia. I am very pleased today to host Sandra Hong, the Public Education Coordinator for the Alzheimer's Society of Grey Bruce. Today, Sandra will share information with us about prevention and early detection of dementia, what memory mistakes adults should be concerned about, and the latest evidence on what people can do to help prevent dementia. So, welcome, Sandra.
Thank you, Nancy.
um, bef-
Happy
be-
to.
Before we get started today, Sandra, we're just going to go through a few little housekeeping rules.
Okay.
So, following our introductions, Sandra will begin her presentation. So, while listening and watching, we encourage you to submit any questions or comments to our web form on the Bruce County Public Library website. And you should be able to see that link on the screen here, or you can share in the comments during the presentation. We will address questions following the presentation. You may wish to take this opportunity to grab a pen and a piece of paper to jot down program ideas and resources of interest to you. And if you don't get a chance to watch live, this presentation will be recorded and posted here on the library's YouTube channel in our special guest playlist. You will find the recording there, so you can watch it later and share with your friends and family. And if you haven't already, remember to subscribe to our YouTube channel to keep up to date with all our live presentations. So for Sandra, through the programs offered by the Alzheimer's Society of Grey Bruce, Sandra is able to help individuals with a diagnosis of dementia in understanding their diagnosis and to focus on their abilities and not their deficits. Sandra helps community members, including healthcare professionals and first responders, better understand dementia by providing them with knowledge and understanding of how to interact with someone who lives with the diagnosis of Alzheimer's disease and other dementia, thus reducing the stigma and providing an environment where people with dementia and care partners are included, supported, and can live well. Sandra lives an active, healthy lifestyle and is a cycling and Nordic ski enthusiast and is quick to promote such a lifestyle to others. So hello and welcome. We're happy to have you with us today, and we're really looking forward to learning more. Some of our viewers may have been fortunate enough to meet you as you have visited with our library branches in person in the past. So I'm so happy today you're able to pivot with us and to provide your information in this virtual format. And I know you have a lot to share with us today, so I'm going to turn it over to you to start.
Okay. Well, thank you very, very much, Nancy. And I'm very happy to be here today. A different way of presenting for sure, but I think I'm getting used to this after almost 12 months. So happy to present to you actually the prevention and the early detection of dementia, because prevention, of course, is definitely key, but in that early detection, in the fact that, reducing the stigma of Alzheimer's disease, even with the diagnosis of Alzheimer's disease, that knowing that we can still live well with that diagnosis. So I'm really hoping that that's what you'll walk away with today. So just in emphasizing that fact, I just want you to, remember these 3 words. I want you not to write these down, so no cheating here. Just remember these 3 words: ball, house, daisy. And then I also want you just to keep your eyes open for a picture of a camel. Okay, so don't write that information down. Just keep that in your mind. Those 3 words and a picture of a camel. So the World Health Organization certainly has declared dementia as a public health priority. Dementia is the most significant cause of disability among Canadians aged 65 and over. And certainly Nancy had kind of went over briefly those numbers. In the US and the UK, studies actually indicated that Alzheimer's disease and dementia are among the most feared diseases associated with getting older. So we're looking at like 564,000 Canadians who are currently living with dementia. 16,000 is the number of Canadians under the age of 65 living with dementia. So certainly we can't assume that this is just people over the age of 65 who have a diagnosis of Alzheimer's disease. And 228,000 is the number of Ontarians living with dementia. So just to really bring things to maybe the forefront is realizing or recognizing that 937,000 Canadians is the estimated number of Canadians who will be living with the disease in about 15 years' time. So keeping that in mind. So what do we see as normal changes? So what happens with aging? The normal changes are that we have trouble remembering names, or we have trouble remembering the lists of things. As we age, we have difficulty with our spatial memory. So maybe when you're going out to the parking lot, it's a little bit more difficult to find your car or remember where exactly you parked your car. 12% of individuals over the age of 65 have what we call a mild cognitive impairment. So 1 person in 5 among our population over 65 actually has significant memory problems. But here, the good news is that 4 out of 5 do not. So here I bring you up this chart just to really give you an idea of what the difference between normal aging, mild cognitive impairment, and dementia look like. And really, when you look at this, you can certainly see that with a mild cognitive impairment, and I don't know if you can see my mouse on the screen, but the bottom there, some impairment evident in cognitive testing when there's a notion of mild cognitive impairment, but also that you see no significant functional impairment, and that the individual may experience some subjective complaints, but also that the family notices those changes. If the diagnosis is actually a dementia, what the significant difference is that individual will have significant functional impairment. And significant functional impairment is the ability to do day-to-day activities. Things that they have done all their life has now been compromised as a result of a disease process. The individual has subjective complaints, may have subjective complaints, and I should emphasize that, depending on their insight, but the family definitely notices changes too. And also, of course, there's that impairment on that cognitive testing that is done. So mild cognitive impairment, when an individual receives a diagnosis of mild cognitive impairment, there's actually 2 ways to go with that diagnosis. So some people are not going to progress to dementia with that diagnosis. However, other people will progress to a dementia if they are followed over a few years. So assessments, continual assessments. So the thing is, or the question really is, can we do anything at this point to prevent people getting worse? The answer, we probably can, and I'll share with you how we can go about doing that. So many times I get this question: what is dementia? Dementia is actually a set of symptoms that accompany a disease, so not a disease itself. The symptoms include, but are certainly not limited to, loss of memory, judgment, reasoning, or ability to complete familiar tasks, such as making a cup of coffee or finding our way home. So there are many causes as to why a person may have dementia, and you see here the reversible causes, such as depression, metabolic disorders, or nutritional deficiencies, they can be treated once the diagnosis is made. Irreversible causes such as Alzheimer's disease or Lewy body dementia or vascular dementia, frontal dementia, or even a mixed dementia are not treatable, meaning we certainly have no treatment for a cure. These are progressive degenerative brain diseases, and they will get worse over time. So Alzheimer's disease and other dementias refers to the irreversible types of dementia. So that's why it's really important when speaking to the doctor to determine with that doctor or have that dialogue as to the doctor is saying that you have a dementia. Do you know what the cause of that dementia is? Is it an irreversible dementia? And having said that, it may not be easy for the doctor to actually say, well, the cause is related to Alzheimer's disease. And you see by looking at this Venn diagram that I have up on the screen that it's really not unusual to see a combination of more than one kind of dementia. So that's where we get the mixed dementias happening. So it can be very, very complicated in trying to determine exactly what the cause of that irreversible dementia is. But asking the doctor, is this irreversible or is this treatable, can certainly help you understand maybe a little bit more of where you're heading. So the dementia is a set of symptoms. Alzheimer's disease is a disease. It's the cause of the dementia. So why is dementia a concern? Well, certainly the good news and the bad news. The good news is the population is getting older, so people are living longer. The bad news is it also means that the number of people with dementia will increase. So the greatest risk of dementia is, of course, our age, and I'll talk more about that later on. About 72% of people with dementia are women. And of course, when you think about all those numbers, the cost to the healthcare system will certainly rise as a result of the increased numbers of individuals with dementia. Interesting fact, though, here that more developed countries that have studies have shown that dementia has slightly decreased in those more developed countries, and potentially just through education and knowledge and the access to food and various programs to keep individuals healthy. So here is an image of a normal brain and an Alzheimer's brain. And I just think that it's good for individuals to actually picture what the disease is doing to people's brains, because of course we don't wear our brains outside of our skulls. So people can't see that this person actually has a condition that is making it difficult for them to communicate or to function the way they normally would. So the brain of people with Alzheimer's disease, and you can certainly look in the brain and see that it's not normal by these images. And if you actually look inside the brain, you can see different changes that occur. And those changes, quite evident here by the screen, is the structural change. What isn't evident is the chemical changes that also occur as a result of the disease process. So two things are happening. There's a structural change and there's a chemical change in the brain. So changes in thinking. So you see things that that should trigger a visit to a doctor, because there are also, again, there's also treatable causes to dementia, rarely but not insignificantly, that we need to look at. So you can't always assume that dementia means untreatable Alzheimer's disease, emphasizing that point. So what we see is changes in thinking, and this is where you may be aware of these changes, or they may have trouble with memory, especially new information. Short-term memory loss is certainly evident. They may experience things such as difficulty with decision-making and planning. And lastly, you may note that there's communication difficulties where they are having difficulty following the conversation or finding the correct word to use in a sentence. And if, of course, we're aware of these changes, we ourselves can support that person much better by promoting the use of images maybe, or giving pause in our conversation to give that person an opportunity to process what it is that we're saying. Also, you may see personality changes, and certainly people with dementia may experience personality changes such as the frustration and mood changes, where they're happy one moment and sad the next, or anxiety may be quite evident, and paranoid suspicious behavior where, I can't find my purse, so you must have stolen it, or, somebody's out to get me. That kind of behavior is evident. So people with dementia also experience changes in their abilities, and those are changes such as difficulty beginning an activity and following the right order of the activity. So again, appreciating that there might be some visual, spatial, or perception problems, such as having difficulty judging how near or far an object is. You may also note that they are less able to recognize familiar things. So it's all about paying attention to what has changed with the individual, and then how is it that we can help to adapt to those brain changes to support the person so that they can maintain their independence for as long as possible. And really, that's what it really is about, is still engaging this person in meaningful, purposeful activity to potentially slow the progression of the disease process. So just going over what exactly is involved in getting a diagnosis. So you see that the doctor will certainly go over your medical history. I mentioned the mental status exam, and I'll go over that a little bit more. Physical exam, see, again, what kind of dementia are we dealing with, a treatable one or irreversible one, the laboratory tests, and potentially a referral to a psychiatric or psychological evaluation may be made. And I just want to be clear, when the doctor refers you to a mental status exam, like a cognitive test, what's going to happen there is the assessment's going to take place with both the care partner and the person with dementia. And really, that is just to really identify with the care partner what support is available and what is needed to help the care partner support the person with dementia. So just letting you know that there is two people that actually come in when that cognitive testing is being done. And the questions that might be asked is because, again, the individual with dementia may not really realize that they haven't made supper for themselves in the last year or so, because the person caring for them has actually been making it. So they may answer that question, oh yeah, I make supper every night, but in reality, it's the care partner that has made that dinner every night. So the doctor or potentially a counselor will ask that person at the time of the cognitive testing, is the person safe in the home? Is there a risk of the person leaving the stove on, or eating food that is spoiled, or maybe there's that risk of going missing or getting lost, or there's the risk of driving. So day to day, is the person just sitting in the chair? What kind of stimulation is the person receiving? And what about the diet? Are they eating well? People with dementia often forget to eat. Is medication a risk? Is there a risk of overdose or not taking medications at all? So talking about planning ahead and plans for the future. Dementia does get worse over time. So now is the time when the diagnosis is made early enough that the person can still participate in their own plans for the future. So that is also a discussion piece. Maybe not all at once at that time of diagnosis, but the door is open to have those discussions for sure. There's medications available to keep a person at a level of functioning, and those medications are what we'd say Aricept, Reminol, Exelon, and Ebixa. So the doctor would decide which medication might be right for you. I do really want to emphasize that not all medication is appropriate for everyone. So if indeed an individual does get a diagnosis of Alzheimer's disease and is not prescribed a medication, it could be because of other health conditions that the individual has. And not to get too fixated on the fact that, oh no, I don't have this medication. Now the progression of the disease might be so much faster, but to realize that there's other things that one can do that might help to slow that progression of the disease. And I'll talk about that very soon. So there's no, I guess, really emphasizing the fact that there's no real treatment to stop or slow the disease after it has been diagnosed. But these are some research tips that I will share with you, and strong research tips. So here you have the Montreal Cognitive Assessment, and this is the cognitive assessment I spoke of that that is done during the memory testing. And all of you should see the picture of the camel on your screen. So hopefully you see that and are remembered to, oh yeah, she mentioned the picture of the camel. There it is. So the MoCA is what we call this for short. Instead of saying Montreal Cognitive Assessment, we refer to it as a MoCA. And the MoCA is used in memory testing. This is what it looks like. It's actually just a 10-minute test that is used around the world. So it's used around the world for telling if a person has normal memory or has some memory impairment. Okay, so this is a test that's commonly used. So I thought I would share with you just where research is. And honestly, you've heard me say this, that we still don't know what causes Alzheimer's disease without knowing, and without actually knowing that cause, it's very hard to find actually the molecule to stop the disease. So we also don't know if Alzheimer's disease is one disease or a group of illnesses. So there's lots of things that are still under investigation. We don't know why some people get it earlier. There are some genes that seem to be associated with getting it earlier. And there are people that are diagnosed in their 50s with early onset Alzheimer's disease. Actually, 15% of people have onset before the age of 60. And again, we don't really know why that is. We don't know how to prevent it coming on, and we don't know how to delay or stop it. So when we think about research, how do we make progress around research? And certainly there's two things in order for that to happen. So people need to participate in research. So what they need to do then is to sign up to get memory testing, and certainly you can sign up to volunteer for research. And I've given you a few places of where you can do that. And I guess secondly is the public support. So really just advocating for the government to increase that public support and financial support on research for Alzheimer's disease. And just so you know, Canada is really lagging behind in the area of research when it comes to other places around the world. So just some sobering clinical points, and probably the downer of my presentation today, that there has been no new Alzheimer's treatment in the past 15 years. And it really points to our failure in understanding the disease itself. Alzheimer's disease is the only major cause of disease without any disease-modifying therapies currently. So yeah, certainly the downer of my presentation. But so here I am looking at biomarkers. So this is again going to our research and what it is that we can maybe determine what the outlook for an individual might be. So biomarkers can define which individuals with maybe a mild cognitive impairment will develop a dementia. So of course there's the amyloid that they look at, there's maybe a PET scan, so that's diagnostic imaging, pretty detailed diagnostic imaging. There's saliva testing, there's spinal fluid and blood testing that can be done. But here's what happens with biomarkers without you getting too excited and wanting to sign yourself up for any of these tests. If you go to the doctor and request these tests, you will be told these are not available for people in the community. So these are just for research. And the reason is when you are doing medicine, you do a test because it is going to change your management, right? It's going to change the way the doctor treats you. So right now, there is no medication or a pill or a drug or a schedule to give a person if they have amyloid in the brain. There is no strategy to actually get rid of that. So knowing you have amyloid in the brain is not going to change your management at the doctor's office. So if you are involved in research protocols, what they want to know these things. They want to do these biomarkers. But practically speaking, if you go to your doctors, they are not going to support you to get these biomarkers done for the reason that they don't have a new therapy. So, how good is your memory? What were those 3 words? Ball house daisy. So I'll give you guys all kudos for those that remember those words without writing them down. So what do we want exactly? Well, yeah, we want a magic bullet. Maybe we want to be able to flip a switch. We want to get rid of the risk of Alzheimer's disease, or, you know, we maybe wanted just an intervention to prevent or reverse Alzheimer's disease from happening at all. But we don't have that. So what we learn, again, from molecular biology, is that the brain is very complicated. And those synapses and brain cells are very complicated. And Alzheimer's may be the end of a very complex cascade of various things happening in the brain. So it may take years or even decades to stop the molecule that stops or reverses Alzheimer's disease. And we have to appreciate that there may also be some subtypes. So one person's Alzheimer's disease requires one treatment, but another person's Alzheimer's disease requires a different treatment. So in having said that, we certainly have a long ways to go. So again, just noting that Alzheimer's disease is a chronic disease, possibly starts 15 years before a diagnosis. It is a gradual onset, and we can make that more so based on various modifiable things that we do in our life. Tests are available to find evidence of changes in brain structure and changes in brain function, and those are the cognitive testing mainly that's done. So what is the alternative here? We all want to know what the alternative is. Well, certainly to bring in something non-toxic, something easy to take, and acceptable processes. And really, the end all is to try and prevent Alzheimer's disease altogether. So in doing that, if we could delay the onset by 5 years, there would be a 50% reduction in the prevalence. So that's the number of people with Alzheimer's disease in this society. And really, if you think about it, this is a very feasible goal right now. So if you try to delay the onset of Alzheimer's disease, prevent Alzheimer's disease for some years, for even just a small percentage of people would be an enormous achievement and would actually enable many more people to reach the end of life without developing dementia. So there is evidence that an important, get this, an important 30% of dementias are preventable. So how can we do this? Well, we look for the risk factors and consider when we're looking at these risk factors that each risk factor is like a punch to your brain, making your brain more susceptible to Alzheimer's disease. So what you see here is non-modifiable risk factors. So these are things that we really have little control of. And a person's risk of developing dementia certainly depends upon a combination of many risk factors. So some risk factors, as I mentioned, as age or genes, we have inherited from our parents are beyond our control. Age, when we think about age, the risk of developing dementia certainly doubles every 5 years after the age of 65. When we look at genetics, genetics is only part of the picture. And what they're looking at is the APOE4. That's the most important genetic risk factor. So whatever genes you may have inherited, most people can significantly reduce their chances of getting dementia through just applying simple lifestyle choices. Certain personalities bring that individual at risk. So introverts and highly neurotic individuals, someone who has, those highly neurotic individuals are somebody that has a particularly bad case of nerves. Other research is going into how environment plays a factor. So where you live, if you live within 100 meters of a highway, the pollution actually slightly increases your risk. So they are, research is getting to learn that things from the environment actually do have an impact on whether or not we may in the future develop dementia. Head injuries, so if you knocked yourself out for a day, you're 3 or 4 times the risk of getting dementia. So really we want to avoid getting head injuries, and as we age, it's, maybe it's an increase, we may increase our risk, our fall risk. So, what is it that we can do to decrease our risk of falling? Cognitive reserve, and cognitive reserve is such an interesting one. So cognitive reserve is developed by a lifetime of education and curiosity. And it really is to help your brain better cope with any failures or declines it faces. So we want to build up our cognitive reserve. So you can really, I guess a good analogy with cognitive reserve is you can think of cognitive reserve as your brain's ability to improve and find alternative ways of actually getting a job done, like a powerful car that enables you to engage another gear and then suddenly accelerate to avoid an obstacle. Your brain can, with a good cognitive reserve, can change the way it operates and thus make added resources available to cope with those challenges. And I wanted to bring this to your attention as well. This is just the frailty piece, because as we age, we may see a lot of elderly people becoming more frail. And so the question then is, can we stop people from becoming frail? And maybe with exercise and nutritional support and good food, we can actually prevent frailty to some degree. So if you know an older person and you think, they're looking a little thin, the best thing you can do is go over and eat with them, or give them a plate to eat in this day and age, because of course we're socially isolating. But maybe it's coordinating a Zoom dinner to have that social connection while you've prepared a meal for them and you're eating your meal and you're eating dinner together, but in 2 different homes. So preparing a brain food meal and encouraging them to work on nutrition and their exercise. And there's no reason why you can't go outside. If you're walking with your neighbor, put your mask on and ensure some distance is met. But encouraging individuals to participate in some form of exercise and socialization. And here you go. Here's a nice list for you. 14 things you can modify to help prevent dementia. And so I'm not going to go over all of these things, just, browse through them. And I'll just identify some things that maybe really stand out for me. And that's the avoiding isolation and loneliness. I really think that we have to connect with other people more. Somebody that maybe you haven't connected with or picked up the phone in some time, pick up that phone and give them a call. It could be that they're just sitting at home waiting for somebody to give them a call. So avoiding isolation and loneliness as much as possible. I think also the whole idea of decreasing stress in our lives. So people with high levels of stress as early as their 40s and 50s have a higher rate of dementia later on. And stress in your later years can compound that mild cognitive impairment of aging by adding to the things you already need to do and remember. So that often just results in more confusion. Right at the beginning here, I get, well, no, on our second column, more and better sleep. And I have to mention this because a lot of people gloat over the fact that, oh yeah, I can make it on just 4 hours of sleep. And they seem quite proud of that idea that they can sleep for just a short period of time. But sleep is very important to your brain. People who get less than 6 hours of sleep are at higher risk of dementia. So what they encourage you to do is aim for 7 or 8 hours each night, because what happens here is it's magical. Sleep is magical. We know that while you're sleeping, what happens is the amyloid proteins, which are the toxins in your brain, are being cleared out. So studies also show that people who have fragmented sleep habits have a higher incidence of Alzheimer's disease as well. So having good solid sleeps is important. And a way to maybe help that is being physically active. That can help tire you out. So, and give yourself some good fresh air to enable you to sleep better at night. Also, a good diet helps you sleep as well. So just being mindful of your diet, not too much sugar or caffeine in your diet, to consider that. Okay, so reducing your risk. Generally, just general principles is that dementia has an important proportion of modifiable risk factors. So realizing what it is that we have control of, that we can actually take a hand on and change for ourselves. So modifying risk factors can certainly translate into a large effect on the global burden of dementia, which would then have a huge implication for social and healthcare needs. And certainly you will find it easier to adapt a healthier lifestyle, like exercising more or eating better, if you can build it into your normal daily routine. So I encourage that, and better yet, getting your friends and family to support you to do that, or even join you in doing that, could be very, very helpful. And certainly while public health interventions will not delay or prevent or cure all potentially modifiable dementia, the management of metabolic and mental health and that hearing, I didn't mention hearing, but certainly it was on my list, hearing and cerebrovascular risks might push back the onset of many cases for some years. So being aware of that. So I'm going to leave this presentation with the idea that I expect you to take action on your own health. So what will you do based on what I've said today? What will you do to maybe start? Because, oh man, that sounds like a great idea. That sounds like something that I need to change in myself. What is it that you need to stop doing because, oh, that's not working so well? And what is it that you need to continue to do? Because, those those morning walks that I'm taking are really, really helping me out in many ways. So you need to continue to do them, or something else that you've identified. So what is it that you will do to start, stop, or continue to do to take action against dementia? So thank you. Thank you very much. Do we have any questions?
Hey, Sandra.
Yeah.
Hang on 1 second here. I'm having volume problems. Okay. Do you think that I do have a question here, and it has to do in relation with COVID. So, just wondering if COVID has had an effect on people that you've been talking with and visiting in the population. You had mentioned isolation and loneliness possibly being factors in helping to prevent dementia. So, just wondering if you've seen anything concerning COVID?
Definitely.
Mhm.
COVID has been so hard on our care partners as well as our people living with dementia. So in terms of the person living with dementia, you can imagine at the onset of COVID, when all these restrictions were in place, their routine was disrupted.
Right.
So a routine where the individual may have attended a day away program or some sort of community program or got together with a friend is now disrupted. And to appreciate that people with dementia rely heavily on a routine.
Mhm.
So without those routines in place and the benefits of that, right? The benefits of going to a day away program for stimulation and socialization for the individual with dementia is phenomenal. As well as from the care partner's perspective, the idea of having the care partner just have a break to
Right.
recharge their batteries, right?
Mhm.
So that has been very much a challenge for our individuals in the community. But I do have to say that, and I'm happy to say that the Alzheimer's Society of Grey Bruce had applied for several grants.
Mhm.
We already had a recreational therapist on board with us, and she was doing lots of online active living programs. And certainly you can go to our website
Mhm.
and you can see the active living website there. But we now have some in-home rec therapists. So even despite COVID-19, we take those measures, of course, those
Mhm.
precautionary measures, to be able to go into the home and do activities with a person living with dementia to give that care partner a little bit of a break. So that's good. I'm glad were able to do that despite all that's going on right now.
Oh, for sure, yeah. And that was kind of like the second part of the question was, how have you pivoted, some of your services and programs in order to help provide service to people and their families. So you'd mentioned the recreation programs, and I know people who have participated with the ones online, and and they have it in their schedule, and they know that every Thursday afternoon this is what we do. So they certainly appreciate those sorts of things that you've been able to offer despite
Yeah.
the restrictions in place.
Yeah, and certainly I do myself as the education coordinator, I do lots of education to care partners as well as people living with dementia
Hmm.
and how they can live well with dementia. So that's ongoing and that's through Zoom. So certainly contacting our office. You see on the screen here, there's an education hour,
Hmm.
and you can go to, again, our website and look at various topics that we cover. If you want to partake in any of those education hour sessions, that's available too to the general public.
Wonderful. That's fantastic. Your group does such great work.
Thanks,
Um,
Nancy.
I did have one other question. It was about you had mentioned if people wanted to participate in the ongoing studies. Um,
Yeah.
just about the commitment for that. Like, does it follow you over time, or um, that sort of thing?
So that's a great question because it all actually depends on the
Okay.
research study,
Hmm.
right? So and actually in if you're interested in participating, maybe I'll bring up that. Can I bring up that slide? Maybe not.
No, I'm not sure we'll be able
Kind
to
of.
see it, but we could add that
That's okay.
information to the description
Yeah.
underneath afterwards. We can
Um,
add those
so
websites in.
yeah, so in doing that, appreciating that that research, there it is. Um, the Alzheimer's Society of Canada participates in research as well as Baycrest. So if an
Hmm.
individual went to any of those websites,
Okay.
was interested in participating in research, it would be a matter of um, kind of, I guess, looking at doing an assessment on the individual to see if they qualify for the
Hmm.
research that they want to have done.
Okay.
So even though you may want to participate in the research, depending on the research that's being done, you may not qualify
Yeah,
for
you
that
might have to
research.
meet certain criteria, correct?
Yeah, exactly.
Got it.
But it's good to look that up and see.
Hmm.
And they will, for however long they want to follow through with that research. Some research studies are much longer than others.
Hmm.
So it just depends on the research.
That's right. And it's the best way, for scientists to figure out, what exactly the causes are and what the best preventions are and what we can do to best help out with it. So, research is so incredibly important, I think.
Yes.
For sure.
Yeah.
Just double checking here. Oh, we've got a couple of likes, so that's nice. Thank you.
Yeah.
Yeah, so I think that was it for questions today. Was there anything else that you wanted to add, Sandra?
I think really, I just want to emphasize the fact that do not hesitate if you do have any questions or concerns, to contact the
Mm.
Alzheimer's Society. We are here to answer those questions, and all our services are free of charge. So we're happy to support you. We have about 6 counselors on
Mhm.
service, and of course, I'm the education coordinator, happy to give you as much information as possible. Really, it's about how is it that we can reduce the stigma, and in this time, even though we have to stay 6 feet apart, we can still be very close at heart. So my takeaway message is don't hesitate to
Right.
contact people and reach out.
Yeah. It'll help for sure.
Yeah.
I just wanted to share too that the library does have, as you have resources that you have, and the library has some resources as well. So I did bring in some books today, just to kind of share just a little bit of a range of materials that we have. So we have everything from cookbooks, healthy eating to reduce the risk of dementia. So some ideas in there for some healthy eating. You had mentioned that in your presentation. This one's Care, a revolutionary approach to dementia and elder care. So that one looks interesting too. Dementia Reimagined, building a life of joy and dignity. So another book there. Of course, we have works of fiction. It's kind of a common theme in some works of fiction, dealing with dementia and Alzheimer's. So sometimes it's kind of comforting to read a fictional story about somebody going through something you might be going through yourself. Or with your loved ones. And then we have some, biographies, autobiographies, stories about, people who have gone through this with their loved ones. So What Dementia Teaches Us About Love by Nikki Gerard is one. Memory's Last Breath by Gerda Saunders is another. And then, of course, one that you may have heard of by Jan Arden, Grieving My Mother. It's a
Mhm.
fairly recent one too, so it's a good read as well. So lots of different materials available. So please explore our catalog or call your local library and talk with a staff member to get them to help you pull some materials together. So we're happy to help you find what you need. Um, yeah. So I guess we're just going to wrap it up. So thank you, Sandra, so very much for coming and sharing your information with us today. It was a wonderful presentation, and I think, unfortunately, the numbers are so high. We're all going. It's going to touch everybody in some way, right? We're going to know someone who is, looking after or experiencing dementia or Alzheimer's. So I think it's important to know that we have these valuable resources available for us. And as you said, for free. So please, we encourage you to reach out and talk with Sandra for sure. So for more information, we do have Sandra's contact information up under the presentation, so you can get that afterwards, or you can visit the Alzheimer Grey Bruce website. As also just a thank you to our digital services coordinator for looking after all our technical details today, and thank you to our communications coordinator for setting up the YouTube event for us and promoting the event. Just one more shout out. Remember to subscribe to Bruce County Public Library YouTube, where you can find more live and recorded presentations, stories for children, and activities you can do at home. And reminder to join us next month when we have two live programs scheduled. We're hosting Stewardship Grey Bruce, which will be interesting to learn about the programs that they sponsor. And also we have a photo slideshow called Wild Birds of Ontario with David Chapman. So that'll
Very
be
nice.
a nice one as well. It'll be a lovely way to while away an hour or so on a February afternoon dreaming of bird watching.
Mhm.
Good for your mental health.
Very good.
Yeah. And so thank you again, Sandra, and I appreciate you taking time to do this with us today.
Okay, thank you, Nancy. Take
All
care,
right.
everyone.
Have a good day. Bye.
Bye.